Hi there, it's Gabrielle Nicolay from SpeechKids and Raising Orchid Kids, where we teach little kids to talk and help parents understand their little kids. And Rebecca, thank you.
So happy to be here.
We are going to talk about your little guy because this is part of the parent interview series that I'm loving doing. Because we don't talk about what it's like to be the parent, a worried parent of somebody who is having some difficulty with communication. So what did that look like for you? How did you know that your little one needed help?
Great. I feel like I could answer this question and take up the whole 15 or 20 minutes, but I'm going to give the fastest version I can think of. Toby is our second son. So I had a frame of reference for our first son, Max, who is very verbal. And I started noticing about probably 12, 15, 16 months, never a lot of babbling, just pretty quiet kid, wasn't starting to make the sounds and being responsive to that. Asked a family friend who was a speech therapist when he was about 14 months old, should I be concerned? She said, call me back in a few months, look for these things. Still wasn't seeing those things. And then so by about 16 or 17 months, then referred him myself to Strong Start in our city agency.
Yeah, which is the early intervention program in DC. And so what did they say?
They took us through all of sort of like the standard things, had his hearing checked. We ended up going to get ENT consult. We had his adenoids removed. We had tubes put in. So all of sort of the physical pieces, and just kept hoping that something would all of a sudden pop, and it never did. We waited a few weeks, and so and we saw them once a week, which felt like good, but also not really enough. In my head, I was thinking, how can this really make a difference? 1 hour a week with a child. What should I be doing at home? What else can we be doing? And so basically at about 19 months, we had given it 8 weeks after the adenoid surgery, which is when we had been promised that it would all of a sudden work out.
And it sometimes does. More often than not, probably not, but okay, keep talking.
No, it didn't. In this case, it did not. And so I just said one day, like, this once a week, we're not really sure what the diagnosis, prognosis, like what's going on. Like, I don't have a clear answer or a theory. I started going through them, as I've heard every parent say, the parent rabbit hole, like the only thing it could be is apraxia. I know it's apraxia. I'm sure it's apraxia. You all think I'm crazy. It's apraxia. My child's never going to talk. All the plans we had for him in life are not going to go as planned. And so then we started calling, just getting lots of referrals for great speech therapists in our area, and just made a bunch of calls.
Okay. So I want to ask you this. I'm not exactly sure how the question is going to come out. In that moment between the time that you were making phone calls and doing your rabbit hole research, can you walk us through briefly, what that emotional process was like for you?
It was a lot of, so I'd say I was trying to convince myself that it could be other things besides what the rabbit hole was sort of telling me. And I think the problem with the rabbit hole, specifically the apraxia rabbit hole, is that there's just a lot of doomsday out there, and you cannot really find out, how is it treated? What are different options? I remember vividly going down the indicators of what gives you a good prognosis for apraxia, what doesn't, and checking off, oh, he doesn't have other medical issues. Oh, he's socially, trying to convince myself. And it was some pretty dark moments, honestly, middle of the night, or, tears with my parents saying no, this is really something, I'm really concerned. But I think I'm also the kind of person that wants to do something about it. And so as soon as I sort of felt okay, I need to talk to a bunch of people, understand what's going on, come up with a plan, I felt better about that.
And did you have people saying to you sort of from that 12, 14, 15, 16 months, don't worry about it, boys are later, everybody's different? Did you hear what are some of the things that you heard?
My mom said she didn't talk till 3. She's a third of very close together, 3 children, 3 girls. So she said, she didn't talk till 3. Lots of, this person says their grandson also, and then all of a sudden they started talking. Pediatrician I don't know if I should say this, but my pediatrician said, quote, when I said, I think it's apraxia, she said, having apraxia is like winning the lottery. You're not going to win the lottery. And so I sort of was like, but what else? I kept saying, but what else? But what else? But what else? Like, give me some theories, and I'm all for it. Mm-hmm. So yeah, there was a lot of calming down, and then there was a lot of like, okay, like go find out your answers.
Yeah. Okay. So then you started talking to people,
mm-hmm.
And how did you do that, and what did it look like?
Yeah, so I think I had talked to 2 or 3 people before we had the consult with you. Mm-hmm. I think I appreciated that there was, that Christina had said, like, just talk to Gabrielle. She'll sort of like get a whole picture and she'll give you some ideas. She said at the time that you don't provide any services, so don't get any ideas. You're not taking new patients, clients. She said, but she's like truly an expert. She did amazing things for my own children. Like, just talk to her. So that was one piece of advice. We saw 2 other we went in for hour-long evals and consults. One person said, like, yes, it's apraxia, was not very reassuring about prognosis, and said, like, yeah, come once a week. And I said, well, isn't it more often really important for that? And she said, yeah, but it's probably not feasible in person, etc. Like, come once a week, we'll see. At that point, I was frustrated because I think we had like been doing once a week. We hadn't been seeing a lot of progress. I didn't understand exactly what it would look like. Another therapist suggested that it was a lot of oral facial, like structural things, and sent us to go to get another ENT. Toby had a tongue tie when he was a baby, to get another consult to see about lip and tongue tie. Again, like, that didn't fully sort of explain what it was. And I think it was really helpful when we met with you to be able to say, we've already talked to these people. This is what they said it could be. This is what they suggested. What do you think? And hear a different opinion.
Mm-hmm. And so when I'll pick up the story for a second, but when you guys came, I think, well, you know what? No, I'm not going to pick up the story. You tell me, what did I tell you when you came?
You said, I remember a few things from it. I could look back at my notes, but things that stuck out to me were, he sounds like a perfect candidate for something I'm trying, microdosing. Like, I think frequent everyday treatment would be really important for him. You said, I want to reassure you now as parents that the prognosis is good. Like, he has foundations of social skills. Your child will talk. People will be able to understand him if by 5, if not earlier. Like, you can calm down about that. I can help support you in ways to interact and support him. Worst case scenario, he will use assisted technology and he will also be great. And so all of that was just like a great feeling. And I think you brought with yourself like a sense of expertise and experience of, I've seen children like Toby. I know what this looks like. I can tell you, can't tell you exactly, but I can tell you a general path that this will go down.
Yeah, good. I'm glad I told you that, because that sounds like what I would have said. And so we started doing these microdose sessions, which I'm so excited about. Like, I'm trying to shout this from the rooftops all the time, but let's talk about, we want to talk about how it relates to your son in particular, which is every day, Monday through Friday, same time, in the high chair, 10 minutes.
Yep.
And what do you remember? Because now it's been, first of all, how long has it been exactly?
Since August.
Since August of last year. So 2021,
Yep.
We're recording this in February.
Yep.
When we started, what was happening?
He had no words. I think I exaggerated that he had words, but I would say honestly now he had no reliable words.
Yeah.
And so it's amazing to see, I remember we read that bug book. We read a book saying hi to different bugs every day, and he couldn't say hi and he couldn't say the bug names. And slowly, I'm an educator by training, but I think it was amazing to see what we sort of learned about, like, the layers of skills being layered on over time that you don't even realize are like the most micro skills. So, big credit to your positivity. You would pull out something, from each daily session. If you went like this to signal a hi, that was a step towards saying hi. And just little steps from this to now, 3-word sentences.
I mean, this kid this morning, right? Hi, G. Well, I don't remember.
See you next time.
See you next time. Yeah. And so now we're up to this point where for the speech geeks among you, we're working on integrating labial and mandibular sounds. So we're working on things like see you, which is like different planes of movement all over the place through syllables. Okay, that's all like speech speak. What it really means is he's expressing himself with word approximations, meaning he is using words to communicate, and more than one at a time, and frequently. Well, I don't know. How does that make you feel, Rebecca?
It's really amazing. It's amazing to think about all the different steps that went into that, right? After the hand motion was a full hand motion, and then was a simply that for high. And now, he imitates all the time. And comes up with generates new thoughts using words that we had not seen before.
And makes connections. Like we'll be talking about something. Today there was The Elephant, the best book ever. Besides the other best book ever. But there's an elephant in that book. And then he's pointing and he's saying bed, or he's saying ba.
Yeah, that he has an elephant in his bed, right? Or that the pool, that you wear a bathing suit in the pool, not right.
Yeah. That actually cracked me up this morning. He was like, no, bathing suit, some version of that was very clearly bathing suit outside of context.
Yep.
And so, yeah, I mean, he's got a lot of work to do, obviously. But I think the thing for me as his therapist, speech therapist, moving through this process has been that as is very infrequent in apraxia. And I do think that he has apraxia. I think he's one of the rare ones where he's a late talker. And I think the reason he has been a late talker is because he has a motor planning issue. That means he knows what he wants to say. He can't get it into his mouth in an organized way to put the sounds in the right order that would make the words that we would understand. And he has been making linear progress through these daily sessions. It's astounding to me. Like that never happens, except that it's happening. And so, you had the sort of the once a week and the once every day. You tell us.
Yeah. We've talked about OT for him and for other people. And I actually now think about therapy. I think, how can therapy not be every day for anything, for any child? Because I think the burden on a parent, that a parent holds with once a week sessions. Well, I guess a parent can choose. Either a parent doesn't choose to hold that burden and hopes that in that once a week, an hour, the therapist can do what they need to do and it carries through the week. Or the burden that I felt with the once a week therapy session was that every day, then when we got home from school, I needed to do some form of mini therapy for him. And I had, Post-its about which drills or whatever to do and what to practice, and keeping track of that, or that every interaction with my child felt like it needed to be a speech session. And at that point, when he wasn't producing sounds, that was just frustrating for both of us. Right. So I think the idea that that every day you are going to do something, at a minimum, that 10 minutes for your child to help them talk, that I'm learning so much. And it doesn't have to be even through coaching. We did the coaching, but separate from the coaching, how much I can just pick up on what you do in those sessions and carry it through the rest of the day is amazing.
It's so interesting. I hadn't thought of that as a benefit, but in the same way that the kids are getting that repetition, the parents are getting that repetition. And so even if you're trying to like drink your coffee or do whatever it is, because we do this in the early morning, you're hearing what I'm doing. And with enough, and it's not just me, I have other therapists in my practice who are now doing this. As far as I know, there's nobody else doing this elsewhere. So I really want to hear from speech pathologists if you're doing this. And I've been trying to reach out to and get people to do it. But the point being, you're hearing every day. And then you're starting to piece together, oh, yesterday she asked the question this way. And today we're doing this book in the same way, but she asked the question a different way. I know I'm putting you on the spot. Can you think of an example where that happened for you? You mentioned it a little bit with the high.
Well, things that I've just picked up on now, maybe that's not a good example, but, yes, you have been emphasizing the end of the song. We sing, see you next time. And we've been working to try to get him to close the consonants. Mm-hmm. So now when he says all done with dinner, I say all done, and he does it afterwards because I saw you do it. And can close the consonants. I don't know if that's exactly what you were asking.
No, I think it is, because so often, I'll say it's so obvious to the professional, time and done, same syllable structure. But right. If you've never thought about that, if you're not a reading instructor or a speech pathologist, who knows that kind of stuff? Right. But you watched me do it enough and heard me say it enough. This is what it means to close a syllable, where then I think it's a perfect example. Yeah.
Or I think there's been times when I've asked you, should I try that? And you've said, try it once, but don't push him on it. Let me handle that part, and you do some of the supportive part at home.
Yeah. I think also the practice on the parent side of just hearing how, and this is in the coaching too, which is hearing what works and reinforcing that, and then getting really familiar with that. Then automatically by imitation, we're sort of leveraging everybody's imitation skills for the sake of the other, because then you pick up that pattern and you start to use it, elsewhere in your life when I'm not on the screen. For the record, we've never met in person.
No. And Toby's not sure. I don't know if you know, I think it would be an amazing experience for him to see you from the shoulders down, that you are a real live person, because you are very real in our house.
So what would you say to a parent who's a little bit skeptical that virtual is a thing for young kids, especially?
Yeah, and I've been told by a lot of, I've said to different people, Toby has virtual speech therapy, and they've looked at me like I was crazy. I would say, first of all, logistically, it has been incredible for our lives to be able to do this. There's no way, even an appointment once or twice a week in person would be a lot harder than logging on Zoom every morning. Mm-hmm. In a pandemic, we have been on there, whether he is snotty, which is often the case, or not. We would have had to cancel a million appointments.
Yes.
We've been able to do it while we've been traveling. Mm-hmm. I also think, and I was going to say this earlier, the microdosing, I think there are mornings at least at the beginning where depending on how he did would impact my mood for the day. Totally honest, right? He had a great speech morning. We are doing this is great. Mm-hmm. Or that was a really tough morning. He wasn't into it, but there was one the next day. So it didn't linger. Whereas I feel if you have once a week therapy and you're he hasn't made progress since last week, I have to wait a whole other week to see if anything is there. Mm-hmm. And we've played with books and toys and all sorts of different strategies. And he runs, when I say it's time for G, 90% of mornings, he runs from all his toys in the basement up the stairs. Once in a while, he needs an M&M to get him started, but usually he is ready to read books or play airplane with G.
You have no idea. It is... I'm such a goofball. It is the thrill of my life to start my morning. I have 2 microdosing sessions, your first, and then I have another delightful family, actually Devin's family, who you saw the interview. You're back to back in the morning. You have no idea what a boost it gives me to see you in the morning every day. And it's been this I don't know, it's so fun.
It's so fun. Me too. And I always think look how much we've gotten done before 8:30 in the morning. You've had really, really significant therapy.
Yeah.
Every morning. Yeah.
Love it.
And he loves it.
I think we're going to just leave everybody with that awesome feeling.
Great. It's wonderful.
Thanks for coming and chatting about this.
Thank you. Oh, can I say one more thing?
Of course.
I think one of the best things is like, you found your person for your child when you found your person for your child. So we talked to lots of different people and it didn't feel right. And I've had a similar experience, but everyone in my life knows about G and everyone in Toby's life. And like, when you found it, you found it. So
yeah, I feel the same way.
Yeah.
Thanks, Rebecca.
Sure.